I ruminate, I doom scroll, I catastrophize, I ask for a lot of reassurance. I think it's also important to acknowledge that we're all going to have like some nerves. The healthy coping skills are so much a work in progress. Like I'm really working on it, but when it comes to my like really, really hard trigger topics, I can't expect myself yet to use my really, really healthy coping skills.
Good morning, my dear. Thank you so much for coming on. Introduce yourself, tell us your name, where you're from, and what you do for work, and what your views are on mental health.
Thank you. I'm so excited to be here. My name is Marcy Katz Tucker. I am a social worker by training, licensed clinical social worker in New York. I work at a clinic during the day, and I also have a private side practice that I work in the evenings. I have a home office, which is so helpful. So I see people in person and remotely from home and in my clinic work. I primarily work with people with primary psychotic disorders. So schizophrenia, schizoaffective disorder, very severe bipolar disorder. And I always say it's the hidden gem population in psychiatry because they're just some of the best people I've ever met. And my views on mental health are very holistic. So I believe schizophrenia is absolutely a real disorder that needs medicine 99% of the time. And I also believe that there are some people that medicine probably makes things worse for them, and that it needs to be so individual and individualized that we really can't use a broad brush. And that's one of the, I think, biggest problems that we're facing in mental health is we're looking for like a solution when really it's the solution is different for every single person.
What got you into that population? Because I also work with that population as well, but it's very, very challenging for me. I work in a community mental health clinic, and it's incredibly hard for me. I mean, I've only been in the field for about 4 years now, and so I'm still new and I'm still learning a lot. So, what got you into it? Teach me your ways on how you work with them because I know nothing.
Oh yeah, no, I'm sure you know nothing. And it's the population is challenging for a lot of reasons, a lot of systemic reasons. My first internship happened to be on an inpatient psychiatry unit with people with psychotic disorders. And I fell in love with the population and the work because underneath the psychosis is trauma. Underneath the psychosis is people who are just scared or confused. Underneath the psychosis are really beautiful humans. So I got to see that a little bit. And then I stayed on working inpatient psychiatry for 7 years. Then I worked at a partial hospitalization for a couple of years. And now I work in an outpatient clinic. So many of the challenges in working with people with psychosis has to do with either the systems that are in place that really fail them or don't help them or just are misaligned, or how much their symptoms get in the way of either their functioning, their follow through. You know, one of the hardest things that we always talk about is engagement. And, you know, why do people fall out of treatment? Why, or we have to like, you know, people are having trouble engaging in treatment. Should we discharge them? Do we like, how do we work with that? That's part of the illness. It's that there is so much trouble with executive functioning. There is so much trouble with cognition. There is so much ambivalence and also so much fear and medical trauma. Like, I don't blame a lot of my clients for having so much fear and ambivalence about, you know, coming to clinic or telling me the truth of what they're experiencing or even just remembering to show up. So many challenges.
So tell me, what motivated you to want to become a therapist in the first place?
Oh, this is going to sound like such a goody goody answer, but I always knew like I wanted to do something helping people. It just always felt good. When I was 12, this was like a really formative experience. Before your bar bat mitzvah, there's an idea or a thing that you're supposed to like do a mitzvah project, which is what we call it. I put in air quotes. But the idea is you learn to kind of, you do good in the world as you're learning how to become an adult. And I have to say, my mitzvah project was I worked with a nonprofit helping people with developmental disorders do like recreational activities. And it felt really good. And then I was like, oh, you can do stuff like this, like as a job and like feel good helping people. And that can be a job. Oh, I want to do that, but I don't know what. So I just kind of then let the universe guide me and follow my intuition to social work as opposed to any of the other helping professions, and then to the internships, and then to the population. So just really following my intuition.
I don't even think that that's like a goody two shoes answer because that applies to me too. I love helping people. I can't see myself doing anything else. Around like 11, 12 years old, I was hanging out with like older teenagers than me, and they would come to me with like relationship issues and just like advice for whatever they were going through. And I always thought like if I could do this for a living, that would be sick.
Yeah.
So
Yeah.
so, I mean, I was looking into like how can I do this for a living? And then obviously I did my research and I saw that I could be a therapist and I'm like, great, I'm gonna do that then. And it's been so rewarding to be able to be a listening ear for people who probably don't have that in their personal lives.
My younger brother and I are 12 years apart. It's kind of funny, the number 12 is like in common,
Yeah.
but we're 12 years apart, and he had a speech impediment at one point, and so we were taking him to a clinic for speech therapy. And I just saw the speech therapists, and they had other therapists too, and I was like, this is really interesting. I really like this, like, the way they're so involved, the way that they're so into it, and just to make sure that this child knows how to speak, like that's incredible. Obviously, didn't go into speech pathology, but found my niche. What they didn't tell me was all the paperwork.
Never tell you about the paperwork. That'll make you think twice.
Yeah, no, definitely. I think if I would have heard about the paperwork, I'd been like, okay, maybe not. But honestly, I prefer this over doing anything math related.
Oh,
So
totally.
Oh my God, same. Like I mean, I used to be good in math in high school, but now forget about it. Like don't like I tell my nieces, my nephews, like don't even bother asking me because I don't know anything anymore.
Sometimes I'm also awful at math, and I've always been awful at math. And I used to say, I swear I can feel my neurons misfiring when I'm trying to do a math problem. But then you put me in a language class, or you put me in a room with somebody, and I can just pick up on the emotion they're feeling. Or you can give me a mess of words and thoughts and just jumble it out. I don't care. I'm really good at synthesizing the emotions and the thoughts underneath there. That is what I can do. But like you asked me to like do long division or add a couple of numbers. Literally, I'm like counting on my fingers still. And I think that naturally there are parts of our brains that are just primed and programmed, first primed and then we program them, but more inclined for certain types of processing. And I think that one thing I wish for this world is we were more understanding and accepting that, some people are just really going to be bad at math, and that's okay. And some people are going to be really bad at language, and that's okay. But there isn't anything necessarily pathological or bad about having significant strengths or weaknesses. And I think we as a culture have gone a little bit too far in the direction of looking for deficits so that we can all be at a certain like level. Like why do we do that to people?
it's our culture, and we were raised very much on a competitive field.
Yeah.
Just, trying to strive to be better than the other person. And I mean, with SATs, GREs, like LSATs, like all those big standardized exams, it's just essentially to rank. I know I was looking at the GRE information for grad school, and I'm very happy to see that a lot of schools have actually put a notification block saying we no longer require the GRE as it does not show any significant statistics. So
Yeah.
I was very happy to hear
That's
that.
beautiful. I love that.
I don't want to go through that again.
Are there any mental health struggles that you've gone through that has motivated you to want to become a therapist?
Oh, I think that the best therapists are the ones that have actually, lived through some mental health struggles themselves.
Yep.
Because it gives us such an authentic, empathic experience. Like when I say I get it, like I mean I get it. When I say I know it's hard, like I know it's hard. I've always really struggled with anxiety, but I'd always found a way to use it pretty adaptively until motherhood, when I was hit with postpartum anxiety, which really trickled into postpartum depression with elements of like obsessiveness in there and just really, really crippling, debilitating, intrusive thoughts and somatic symptoms. And it was just really, really hard to function. And so finding my way out of that and finding the combination of like what works for me. Yeah, some medicine, absolutely therapy, finding ways to, not that I hadn't been in therapy before, but being like, yeah, you need to go back to therapy right now. And you need to be there every week for a long time. I just uncovered so many things about myself and my situation and our culture. And it made me a deeper human, and it made me a better clinician. And then also finding ways that have nothing to do with classic therapy, but really mindfulness aspects of putting myself first, not feeling guilty that I need to exercise every day because I get really depressed if I don't, not feeling ashamed that I yelled at my kids today because they spilled the orange juice when I told them they would spill the orange juice, and then they said they wouldn't, but I know it's just like not getting too hard on myself, because those are just human things, and acknowledging and letting the emotions flow as opposed to criticizing and judging myself for having them. That's gone a long way in just allowing myself to enjoy motherhood a little bit more.
What are your triggers? Like, what are some things, some situations that make you anxious?
I feel like I need to categorize that, and we need to have a whole separate podcast on different anxiety triggers. Probably most predominantly, most recently, is anything health related for my kids, for myself. So anything health related will trigger my anxiety. A runny nose, a cough, sneeze, hearing about an illness in one of their classrooms, any of that kind of stuff will really just kind of send me spiraling. That's still something I'm really, really working on. That's like, it's hard.
I'm sure. And what do you do to cope with that anxiety?
I ruminate, I doom scroll, I catastrophize, I ask for a lot of reassurance. I think it's also important to acknowledge that we're all going to have like some nerves. The healthy coping skills are so much a work in progress. Like I'm really working on it, but when it comes to my like really, really hard trigger topics, I can't expect myself yet to use my really, really healthy coping skills. And it's going to happen that I'm going to fall down the Google rabbit hole sometimes. And it's just, can I not go down the Google rabbit hole?
Don't do that.
Don't never do that. I'm also a victim of that though, so I can't talk, but I just know going down the Google rabbit hole is never good.
It's never good, but can I stop myself sooner? Can I not click that one extra link? Can I distract myself after, less time? That's where I think the self-compassion comes in also, is when the things that are like super, super hard are still happening. How do you give yourself forgiveness for not being perfect at managing it? Because it is that hard.
And it's hard to have to set those boundaries too, I am sure. Like the limits on using your phone to like not go on Google and do all that. And plus with Google, you're dying with every condition that you have,
totally.
Which
Totally.
doesn't make it any easier too.
No, it's awful. It's really, really awful.
Has it been difficult for you to like set limits when it comes
Totally.
to okay.
Totally. It's really, really hard. And that's one of the ways the Instagram account has helped too, is that when I'm on my phone and like, oh, I could Google like, what could this be? Or I could like make a post about something about, schizophrenia. I'm like, oh, it would probably be more productive if I educate the world about schizophrenia than kind of catastrophize about, what this rash could be.
So you distract yourself, which is good.
Yeah, I do use distraction.
It's
That's
so
good.
easy. Yeah, it's so easy to put ourselves in those rabbit holes of anxiety, like what we should be doing or what we could be doing or what's going to happen. What if this happens in the future? Like, it's awful.
I was driving to a party with my friends, and it was at a house of an ex. And so the whole time on the drive, I was like, I'm getting anxiety. I don't think I should go. I think I should turn around. They're like, Sam, we drove like 25 minutes already. You're not going home. It's fine. Like, you guys are good. I'm like, I know, but still, like, that anxiety is always going to be there, even just like thinking of the one little thing that could possibly happen. So I understand where you're coming from in the catastrophizing, because Ashley knows that happens a lot.
And that's the thing about anxiety that I also tell people. And another one of the things I say a lot is that anxiety and paranoia are cousins, because they will constantly grow new tentacles. Like you kind of conquer one piece or one thought about anxiety, and like something else would be like, oh, but what if this happens? And then you're stuck on that one. So it just has this way of growing around you. And anxiety and paranoia are so similar in that way that when people say, oh, like, how do you deal with people who have paranoia? How do you work with that? Connect to your anxiety. Most people can connect to anxiety and what that feels like. It's very, very similar. So I always say anxiety and paranoia are cousins.
How are they different?
They're more alike than they are different, actually. I think that the main difference is that paranoia has a malevolence to it in the feel of the symptom and in the ways you feel you need to protect yourself. Usually, paranoia is about somebody purposefully or something purposefully being targeted towards you, whereas anxiety is just like what ifs on steroids.
You said that you would kind of like beat yourself up because like you yelled at your kids a certain way. So I wonder how you practice self-compassion now to yourself. Because like we're so quick to be compassionate towards other people, but it's so hard to be compassionate towards ourselves. So how do you do that for yourself?
It's a struggle. It's a struggle, but I do a couple of things. And the first is I always focus, and this is true as a mother and also in our work with our clients, I focus more on the repair than the rupture. So yeah, I yelled, but when I was able to then re-regulate, I come back to them and I kiss them on their head and or whatever is right in the moment. And I tell them, I'm sorry, that was not okay. I lost my patience. When I lose my patience, it's my fault, not your fault. When I lose my patience, I'm in charge of my patience. And that I always love you. And even when I'm struggling with your behaviors, even when your behaviors, I don't love your behaviors, I always love you. So I focus on the repair and the message that they're going to walk away with rather than, remembering that mommy yelled. I mean, I hope they don't remember both, but I'm sure they will, but I hope they remember more strongly is the repair, because at least in the therapy room, those are the moments where we do make the biggest progress and connection with our patients. It's when we do get something wrong or we make a mistake and we have to repair it, because it requires us to be vulnerable and us to acknowledge how imperfect we are. So I try and take that same approach with my kids. And when they still love me at the end of the day, then I'm like, okay, maybe it's okay that I yelled because what they did was really, really annoying.
That's so important, though, for the parent to take accountability for their actions.
But also to give themselves that grace to work through it and be able to acknowledge, yeah, I did this. They're kids, they're my kids. And so I get to have that moment, but also remember they're going to make mistakes as well.
Yeah, and I think the other thing is that like my kids are getting to a point, they're 6 and 3 right now, where they know how to push my buttons and they do it on purpose. And I know when they're doing it on purpose. So they are intentionally trying to see where my limit is. And then they find my limit. We all find my limit. And we all know when we found my limit. So like I think that there is also a piece of them that is learning, when I do this, yeah, there will be a reaction. Like my actions have consequences on people's emotional states too, because they are absolutely trying to figure out what it will take to drive me up a wall. And they know how. They're so good at it. It's like they get this gleam in their eye. They're like, oh, mommy won't like if I do this. Let me do it.
It's more like I said earlier, competition. We're trained for competition. And so now it's like, let's see who can get mommy mad the fastest.
Totally. They're equally good at it.
But I say the accountability piece is so important because a lot of people grow up and say like, I never had gotten I'm sorry from my mom or my dad about X, Y, and Z. And that causes resentment as they get older.
It causes resentment. And I think for a lot of people, it also causes self-blame, especially people who are more on the sensitive side. And when I say I also do holistic therapy, I also believe and work with a lot of people who are highly sensitive people, which is another buzzword that I think has gone off the rails a little bit, but people who really feel and experience the world in a deeper, really deep and intense way, just at baseline. And I think people who are naturally sensitive are much more likely to say, oh, well, if mom didn't apologize, or if this is just what happens, and then we move on from it without any kind of reconciliation, well, it must be my fault. I must be doing something wrong. I must be wrong. It's me. And then they learn that.
I know so many people who, it's true, they do self-blame and say like, maybe I wasn't enough for like an explanation. Maybe I wasn't enough for them to be able to sit down and talk to me about X, Y, and Z. That piece is really, really hard.
Or even before that, maybe I was just that bad. Maybe I am that bad. Maybe I'm not worthy of it.
Crazy how those things really take away somebody's self-esteem.
Totally.
Earlier, you mentioned preferring holistic approaches. So, what are some holistic approaches that you use in your private practice?
My favorite thing, which I don't even think should be, I mean, I think everything should be part of being holistic, but I love walk and talk sessions with clients. I love walk and talk sessions as a client. I think moving our bodies is something that we don't do often enough. And some people, I think, are even more stressed out when they're like told, oh, you're going to sit in a room and you're going to have to talk. Well, what if you're walking? Talking can just come more naturally, and there are other things to look at. I read also somewhere that, you know, the way your eyes have to move when you're walking back and forth is somewhat reminiscent of EMDR work. So you activate those same parts of the brain to kind of release trauma. So I love walk and talk therapy. I like breath work, but I also am very flexible about that. So I tell people, like, just make your exhales longer than your inhales. You don't need to get caught up in having to do box breathing properly. You don't have to get caught up in counting. Just make your exhales longer than your inhales. So I'll have people practice doing that. In my private office, I have like a rug and some like throw pillow. Sometimes I tell people, sit wherever you want. Some people sit in the chair, some people sit on a pillow, some people sit on the floor. Whatever works for you. You don't have to be like stuck sitting on a couch with me across from you. You can do whatever works for you. Take your shoes off. I hate wearing shoes. So aromatherapy, I have aromatherapy in my office. I love using like crystals, and I encourage just like letting yourself fidget with things. So really letting yourself be a whole person and including all of our senses in the work, and not just thinking like, oh, what is the symptom that we're working on, and what are some evidence-based therapies that we can use to make that symptom better. Yes, let's do that, but that's just one piece of it. And all of the other stuff is really what makes the evidence-based stuff comes to life. Because if you just go like straight into like some CBT without rapport and authenticity and connection and letting a person feel comfortable and knowing whatever that is allowed, a lot of people bring a lot of shame or fear that whatever will make them comfortable won't be allowed. It is here, and you can't do the real work unless that whole person is addressed and the whole person feels comfortable.
I knew nothing about holistic therapy up until now, to be quite honest with you. Like I obviously you see it everywhere, but like I've never actually read up on it. So like the fact that I hear it from you, and it sounds like it's all really about building that rapport with your clients and making them feel really comfortable and for them to be their authentic self.
Yeah, it's about seeing the person as a whole and treating and working with the whole person, not just working with, you know, their symptoms or their diagnosis. So I think holistic therapy is a little bit of a buzzword these days, which in some ways is good because we are trying to treat more of the whole person. But I think that really what it just comes down to is really individualized work and seeing and treating and working with the whole person authentically.
Now, you're a therapist and a mom. What do you do for self-care? Because like you sound like you do so many things at once. I don't know how you do it. Talk to me.
I lose my mind a lot. I think it's in like the little things. I've figured out like what my needs really are, and I really try not to compromise on those. And I recognize like also how much privilege and support I have. Like I have a lot of help, but I need to start my day with exercise. It's the one thing that like I really need to do. And everything else, it's like little stuff. It's making sure I do get coffee in the morning, whether or not it's, you know, cold because I've been chasing the kids around, or, you know, sometimes I have to make it, sometimes I need to buy it, whatever it is, I just have to get my coffee. I don't know. I feel like a hypocrite because I'm not the best at it. I don't think anyone is the best at it, but I'm trying. And honestly, my Instagram account has been a big form of self-care in that I make a post or I write a poem or something and I put it out into the world, and I don't, wherever it goes, whatever it does, it's no longer inside of me. So it helps me to regulate a little bit by just having a place to put things. Because I've never been big on just like actually physically like writing journals. Journaling itself just has never been great for me. I've never been able to stick to it. So the Instagram account has actually been a form of self-care for me.
At the beginning, I know I had the biggest issue with our Instagram account, just like being vulnerable and being actually able to speak out and just be raw. And I know it took me ages. And every time I would go to Ashley and I would need validation. It's like, oh, is what I'm doing like correct? Is it okay? And she'd always be there. She'd be like, Sam, it's fine. Sam, it's fine. Sam, it's fine. So how did you feel? Because I mean, for us, we're two people. So I can go to Ashley and be like, hey, is this good? But you're the only one running your Instagram account. So how do you feel in terms of being that raw and being that open on social media?
It's funny because I avoided social media my whole life. Like I really do not like and have maybe villainized it a little bit because I don't like the idea of kind of being like, oh, look at me. I really struggle with that. So making one to me was like, oh, am I gonna be like, ooh, look at me? I don't want to. That's not what I want to be about. Then I'm like, oh, but then I'm also gonna have to be like, oh, look at me and how messed up I am. But look at all the things I also think I know and want to help you with. Like it's just so many mixed emotions, and yes, that feeling of vulnerability, and the is it okay? I think I look to a lot of other accounts and like I see like, oh well, if so and so posted this, then it's okay if I post that. So what I'd like to be able to give myself the validation to be like, this is valuable, and whether or not it gets one view or 100 or 1,000 doesn't really matter. It's something that is important for me to put out in the world. I'm working on that. So I think yes, viewing it more as something for myself, and whatever good comes out of it, if there's one person that does connect to something I've posted that lightens their day, or I've posted things about suicidality, and if it connects to somebody that then calls 988 or talks to somebody instead of hurting themselves, then that is more than enough. And I may never know that, and that's okay.
That's how I feel now about our podcast. As long as we're bringing out the message, like then we're happy, because I think what's more important now is just building those connections, whether that be with therapists, whether that be listeners in general. We get comments all the time of like, oh my God, thank you so much. Like I needed to hear this, or like this was an important topic. And like that is rewarding. Like
Yeah.
this is why we decided to do this podcast. And especially me, because I was the one who wanted to have a podcast in the first place, because like I feel like I've just been through a lot of my life. And like I just want to be able to let people know you're not alone. Like we go through shit too. We don't have our shit together the way that people think we do, the way our clients think we do.
Totally. I think that's a really important piece, and something that the therapy world is shifting towards in a positive way. Just because like what we are good at as therapists is we are good at helping other people kind of figure out what's going on for them. We were good at synthesizing your story or naming emotions or offering different ways to try and approach something. That does not mean that we can then, go around and be perfect humans or do some of the same things for ourselves. Sometimes I think that makes us feel like hypocrites. I think it just really makes us empathic and understanding to the struggle. Like I know when I say, yes, try and take a day off. And then when I myself have a really hard time taking a day off because I don't feel well, oh God, I get the struggle. But then I also like people don't deserve a crappy therapist. They deserve a therapist who is able to give them their full attention. So I try and tell myself that, and then I feel guilty or whatever. And it's being human is so hard. That's probably the thing I say more than anything else. It's really hard to be human.
Yeah, I agree, especially because I'm the type of therapist that tells you to do journaling and like take a self-care day, but I don't do any of that myself. Like you, I don't journal either. I don't know. It's just journaling has just not been my thing, but I find it to be very effective for my clients. I've always been the type to be like, you should try this or you should try that. But me doing it myself, forget about it.
On the other spectrum, here I am, and I'm telling people, you should go to a boxing class. You should do physical work. Actually, go outside, breathe some fresh air. If you need a punching bag, get a pillow, just release all that energy.
Mhm.
I'll recommend journaling depending on the client and depending on what rapport I get with them. Because if I see that they're not the type of person to journal, that's going to be really hard.
Yeah, exactly. And that goes back to like just the whole holistic idea and knowing the person. Instead of suggesting like, oh, you should do this, I ask, well, what about this? Do you think this would work for you? Do you think that would work for you? I think it's an empowering approach to do the same thing. Asking somebody for their opinion about whether or not that even sounds appealing. And if they say, oh, maybe, okay, try it. And they say, oh, no, okay, fine. You know yourself better than me. Whatever works, works. Whatever doesn't. And, we're the same way. We know what works for us. We know what doesn't work for us. And sometimes that changes, and sometimes that shifts. And that's okay. We're evolving people.
Now, what advice would you give someone that's trying to get into the field?
I would say figure out what population you like working with, because that is probably the most important thing, I think, for me. No matter the setting I've been in, even when I really have not enjoyed the setting, liking the people I work with, liking the kind of symptoms we're trying to manage. Because if you like what you do and you like the illness you're working with, you like the progress you're making, it's gonna color your whole work experience. I also think it's important to acknowledge which population can you not work with because of your own unhealed wounds. So like if you are not yet ready to work with people who have addictions because you lost somebody in your family due to addictions, don't work with that population just yet. Like wait, like that one day it might make you a great clinician, but like don't work with a population that will be triggering, that you won't be able to be an effective clinician because you'll still be coming from your own place of countertransference and unresolved wounds. And that's like what makes us good professionals, is like we can call upon and we can use those experiences and emotions, but that's not what's driving the treatment. That's what's informing our approach. Mm-hmm. So finding those populations that are, not now or never, for whatever reason, that would not make you the best clinician for that population.
That's so funny that you say that too, because I'm not working with people who struggle with substance abuse, alcohol, all of that. I was like, I'm not doing it, can't do it, sorry, because my brother is an alcoholic. I've seen all his things, the things that he's been through, and it's just like, I don't have the patience for it. Not because I don't want to help them or anything like that, but it's more like I want them to be sober more than they would want to be sober. And then I feel like it would just frustrate me.
And you also need your work life to be a little bit different than your personal life. When there's so much overlap, then you get that compassion fatigue. I could never be like a teacher because like I would come home from like kids to more kids. Like I couldn't do it. Or I couldn't work in pediatrics because I can't deal with kids and then come home to kids. And like my son is like running around the house, losing his patience with my or rather testing my husband's patience. So like I just couldn't.
As soon as I get clients who are using, I don't know, some sort of substance or alcohol or whatever the case is, luckily we're able to refer them out to another program that we have, a substance use program that we have, which makes it so much easier. I tried to work with people who are like alcoholics and such. I tried just to see like how it would go. And then, they would relapse. And then I'd be like, ugh. And then I would beat myself up too, because I'd be like, I'm not doing enough for this person to stay sober. You know what I mean? And I had this conversation with one of my clients. He was very attached to me. He was like, I feel like I can open up to you, but I also recently used cocaine. And I'm like, yep, nope, I gotta refer you out. Obviously this isn't working here, but I would always beat myself up because I was like, man, I thought like we had a good connection. And I also thought like he was actually doing the work.
I have a thought, not to get all therapist-y on the therapist. But there's such a similarity between that and the psychotic population, the relapse, the struggling with the medicine. There's that same frustration of the struggle between wanting to get well and having to do the things that you need to get well. There's a lot of overlap there too.
Interesting. I don't know. Maybe that's a bad way of thinking, but
no, I don't think it is. I find it curious because it's so similar in the relapse, the struggle of relapse, and also the high level of dual diagnosis for people with psychosis and psychotic disorders having used substances, because really they're trying to like manage, they're like, what the fuck is going on? And they try and manage it when they don't know what's going on for real with all sorts of substances, whether it's pot or alcohol or something else. A lot of that stems from, or at least starts by, just trying to manage the early symptoms of psychosis, and then they go off the deep end.
Absolutely. I'm open to trying to continue to work with them, but it has been a challenge for me. I mean, maybe not though, because like I still have those wounds of my own when it comes to my brother, you know?
Totally. Like, you don't need to justify it. I think it's we know our limits, and we know why our limits are what they are. And then some things will remind us of our limits, and we dance close to those limits, and that's when like good supervision is really important, because how do we make sure that as we get close to our limits, we are still able to bring our best selves and bring our most healing selves to the room.
That is so true. And you know what? Thank you for validating that for me, because like to know that I don't have to, if especially if I just have my own wounds, like that's so validating.
You know yourself. You know who you want to work with and who you don't, and that's fine. That's important. Knowing who you wouldn't be a good therapist for, knowing who I wouldn't be a good therapist for, is just as important as knowing who I would be a good therapist for. Like, I really struggle with, this is going to sound cliche, but I do struggle with personality pathology, and I wouldn't be a good therapist for people with predominant personality pathology.
In terms of personality, I struggle with those too.
If it's an element in there, sure, that's on me to work with. But if it's somebody who's primarily personality pathology, I'm not going to be able to bring my best self. And that's important to know and acknowledge. Anecdotally, I've found that people I know who work really well with personality pathology are like, how do you work with psychosis? And the people who really love psychosis feel the same about personality pathology. And it's totally anecdotal from clinicians that I've known.
I'm a big believer of that too. Like if I'm not my best self, then you deserve somebody else that can give you their 100%.
Yeah,
you
totally.
know, because I care about my clients so much that if I can't give you my 100%, then you deserve better. So on a scale of 1 to 10, 10 being the best, where's your mental health at today? And if it's not in the best place, like what are you doing to address that?
It's actually probably an 8. It's pretty good because I got good sleep.
Love that.
Sleep is so foundational to wellness. That's another thing I say all the time. Because I got good sleep, because I don't have anything triggering me right now. All of my triggers right now are internal. So right now I'm feeling anxiety that my husband's been watching my son for a whole hour alone. I'm feeling guilt that I've done this podcast because it's something I want to do, and it's asking more of my family on them. I'm feeling all of these kinds of, but it's all internal. It's all self-created. So that's what's making it not a 10. And the fact that I'm not currently dealing with any triggers. Like if I get into the car and pick up my daughter from Hebrew school and she like says she doesn't feel well and like has a fever, like it's gonna be like a 4, like immediately. So it's a transitional thing. It's constantly changing.
You know, that's so real. Like I really appreciate that you were like, you know, I'm giving myself anxiety because I should be out there with my son right now and my husband's out there alone. And I'm beating myself up that I'm on this podcast. Like that's so real. But you know what? Like you're allowed to be selfish every once in a while and do things for you. You know, like you're doing great by spreading a message here.
Easier said than done, right? Like it's,
I know.
I cognitively totally get that. I cognitively 100% in there, and still I'm squirming because I hear footsteps across the house. And I think that just acknowledging that, accepting that, and sitting with it and living in it, as opposed to trying to tell myself anything to placate myself. Like, it's okay. Like, I'm working on it. Yes, I'm allowed to do this. It's not a bad thing. It's a good thing. It's a good thing for myself as a human, as a profession, for putting all this stuff out there in the world. And I'm also still sitting with guilt and anxiety.
All right, my dear. Well, Sam, do you have any other questions?
No, I mean, I could ask each of you questions and like have a conversation for hours on end.
No, and I wish we could do that, because that would be great. I love that. Honestly, I love having like long conversations. Ashley and I are usually on FaceTime for like hours on end, just having
Yeah.
like random conversations. So that's a very big possibility.
And I love when people
Anytime.
ask us questions too. It's
Yes.
awesome.
So if you have a question that you want to ask us, you're more than welcome to.
Well, now you're asking me to weigh like my guilt and anxiety versus my curiosity about you.
It was an absolute pleasure, especially like I said, like you were so authentic. You actively said, like, I'm an overthinker, like I beat myself up, and like that's real. And I'm sure that people that are watching this, therapists or not, they're like, oh my God, me too. Like I feel the same exact way and I struggle with the same exact things. You were doing wonders here, sister. So I really appreciate it. Thank you so,
Thank
so
you.
much.
Thank you guys. I truly enjoyed this.
All right,
Thank
everybody. Thank you so much for watching. Please like, subscribe, share this with your friends and family. You can listen to us on Spotify and Apple Podcasts at Therapists Unmasked. Follow us on Instagram and TikTok, therapists_unmasked. And we'll see you guys next time. Bye.